Hello, we're going to be talking about week 7. We're going to be talking about alcohol and behaviors. And I want to start with an overview this week. I will be posting this video lecture here too. So I'm moving to this page. Come on, move. Okay, so your learning objectives for this week are, I really want you to know the alcohol effects. Explain how common alcohol, ethanol is the drug in there that's addictive, is a drug. The role of alcohol in polydrug abuse. I want you to know what alcohol dependency is. I want you to know why it's particularly bad for adolescents, and I want you to know the difference between moderate and heavy drinkers. I also want you to know what is considered an alcoholic, what the characteristics of an alcoholic is, the cultural views about alcohol. I want you to know the difference between codependency and enabling, and then list 2 major factors that alcohol treatment must consider. I also, not listed here, and I'm going to go back and put it here, is we're going to also cover the different types of alcoholics too. And I'm going to show you those discussion questions. But here's your PowerPoint. I'm going to go over this quickly, as always, and I want you to go through your chapter reviews and really get your heads wrapped around what the effects are. Alcohol is considered a CNS depressant, so it actually slows down your system. So you can see how like using alcohol with another CNS depressant can be fatal. It is considered the most widely consumed drug. It is considered an addictive substance. 2 million people receiving treatment for drug abuse, and 64% are being treated for alcoholism. The big thing is that alcohol is really used as a social lubricant. In other words, it helps people kind of get through socially awkward situations. So anyone who's ever suffered social anxiety of coming into a party and thinks, I need a beer, I need a glass of wine, that is the whole idea of trying to get using alcohol to kind of help people navigate through all that social interaction. 4 big reasons why people view alcohol as a non-drug. 1, alcohol is legal. We know alcohol is a drug, but it's a legal drug, and therefore it's considered an illicit drug. It's advertised and it's promoted all over the place. Large distribution and sales of alcohol. You'll see it everywhere, and we've had a long history of alcohol use in our country. We know that there's a negative impact, over 100,000 deaths associated with alcohol each year. And I think each of us probably are thinking of a family member or someone who's struggled with alcoholism. And I want you to know that I always cover each one of these with an idea that somehow we're all kind of affected by alcohol use, or as we go through each one of these drugs in this course, there is usually someone who's been impacted. Nearly 50% of all Americans will be involved in an alcohol-related traffic accident, but it's really not an accident, it's an incident. In other words, it's not an accident when someone drinks and drives. And over 50%. More than 2% of nighttime drivers have a blood alcohol content that exceeds 0.08%. So as you're driving out there every night, we are putting ourselves at risk when people start to put themselves behind the wheel with alcohol use. And I'm going to say marijuana too. Marijuana has been thrown out. I'm noticing people forget that that's a drug too. Alcohol is a drug. It creates dependency. It disrupts families. It creates illnesses, accidents, and violence. And it's consumed by college students and that we're looking at over 2,000 deaths per year. And college students are the ones that are really impacted by this with binge drinking. Fetal alcohol syndrome. Alcohol is the 2nd leading cause of premature death in America. And $250 billion is spent annually dealing with this social and health problem. There are 4 types of alcohol. There's methyl alcohol, which is poisonous. Isopropyl alcohol, which is poisonous. Ethyl glycol, which is poisonous. Ethanol is the drinking alcohol. So when we talk about alcohol, we talk about ethanol when it comes to drinking alcohol. The body is affected because obviously it hits the stomach, esophagus. It proceeds and it's absorbed by the bloodstream. And then we start to get something called blood alcohol content. Blood alcohol content depends on what's in the stomach, how fast alcohol is consumed, the concentration of the alcohol, and how much the person's body is. So we know that alcohol has no vitamins, no minerals, no protein, no fat. It's just a large amount of carbohydrates associated with calories. And so you need to know that the liver has a hard time processing this. And this is why the liver will become fatty, because there's absolutely nothing in alcohol that we can use for our body. There's something where it's called cross tolerance, where we can actually build up our tolerance to alcohol and then also build up our tolerance to other drugs. And there's something called behavioral tolerance, where someone can consume a great amount of alcohol and not appear to be drunk. Think about that. They are still drunk, but they appear not to be drunk. Almost 5% of consumed alcohol is inactivated by the liver, so the liver has to shut it down. The liver metabolizes the alcohol at a slow and consistent rate. And therefore, 1 can of beer is consumed each hour. So think about it. 1 drink per 1 hour. So that means that caffeine can't get someone sober. It's time that gets someone sober and the body's ability to break it down in the liver. So here's a really good chart on how it's done. From the mouth to the stomach, to the small intestines, to the bloodstream, to the liver, to the brain. And you need to know that carbonated drinks open up this the stomach and dump everything into the small intestine faster. So carbonated drinks actually speed up the process of alcohol. So people, when they say, oh, the champagne's gone to their head, it usually literally does, because of the carbonation opens up the pyloric valve and it dumps it into the small intestines. So with that, then we need to talk about polydrug use. So it's very common for people to take alcohol with other drugs. And this is what leads to overdose. Alcohol enhances the property of other CNS depressants. Sometimes people take expensive drugs and they use alcohol to just use less of another drug. Sometimes they use it to self-treat because they're side effects of other drugs that they're trying to get to go away. And it's just, you'll hear people joke about it. Comedians will joke about it. They'll say, hey, I'm going to have a glass of wine and Valium before I go to bed tonight. No, that's how people overdose. That's called polydrug use. So there's short-term effects of alcohol. So first thing is they start to feel disinhibited. They start to feel like they can do things. They feel euphoric friendly, aggressive and hostile and euphoric, but then they start to lose their motor and reflexes and coordination. So sometimes people say, oh, people get hyper with alcohol. But remember, that is very short-lived, because after that it moves into its depressant role and you'll see them pass out, lose consciousness. So that's what alcohol does. Then they start to, get their heart rate up, their blood pressure up, begins to lower, and it makes them hungry. They start to urinate more. They have gastric secretions. In other words, their body is trying to get rid of things. And so that's what happens. At higher doses, it really starts to become difficult for them to even function, because it's depressing the central nervous system. And then, of course, it induces a hangover when the drinking stops. So a lot of times people will start drinking again to get rid of the hangover. If it's consumed really rapidly, it really depresses the brain system. And this is what we call a binge drinking, but also when people do too much. And when they get to 0.4, 0.6, it's lethal. They could die. Their brain could shut down. Their respiratory system could shut down. So, true or false, drinking black coffee and taking a cold shower or breathing pure oxygen will hasten the sobering up process. False. The type of alcoholic beverage you drink can influence the hangover that results. I'm going to say false. It has a lot to do with how much you've consumed. Taking aspirin caffeine combination after drinking helps the sobering up process and the chances of having a hangover. No, your body will still need time to process, and your liver is what's functioning. So caffeine and aspirin help with the symptoms, but they do not help with the sobering up process or the chances of reducing a hangover. A hangover is a hangover. A sobering up process is independent of caffeine and aspirin. So here's how the brain works. This is your limbic system, and you've got your different parts of your brain. It starts to actually impact your brain stem at higher doses. Moderately high doses, it starts to impact the cerebellum. And then it also impacts other parts of your brain too, the pituitary gland, the different parts of your brain. I'm going to go ahead and post an NIH video on alcohol so you could see how it pushes GABA, and it makes you feel, all of us feel more relaxed most of the time. Now, for some people, they can have a genetic response to alcohol where they get violently ill or they get a red glow and they can't process it. So I want you to know that that's something to keep in mind too, the genetic effect. Dependence is when people start to become dependent on, they become physically addicted to it. So they can't stop drinking it, or they start to get delirium tremors. They start to actually have hallucinogenic, when I want to say they hallucinate. That's the word I'm looking for. So they become dependent. So there's medications for alcohol for dependency. There's an anti-abuse, which makes it very unpleasant for someone to even drink alcohol. So if they drink it, they will throw up, and they use this as a way to make people not drink again. And that's a behavioral change thing. There's an opiate antagonist, which helps relieve the craving in 20% of alcoholics. So there you go. You can see another drug coming in to block the uptake and to make alcoholics feel less dependent. Crampa also reduces withdrawal in abstinent alcoholics. So that means that they cannot be drinking. And also I can add in there that other benzoids like Valium and other things have been used to pull somebody off of alcohol too. So you can read about that in your book. So alcohol and genetics. Alcohol is the most inherited mental health illness. So someone's ability to process alcohol and to crave alcohol is tied to genetics. And it's something to be very aware of, because we have in the United States, across the world, genetics play a role in flipping that gene into craving alcohol or reacting to it. But however, environment is as important as genetics. So what people are exposed to makes a difference. As far as your body's concerned, so you get genetics playing into the system, but once someone starts to process, their ability to process alcohol has a lot to do with their body and the enzyme that's produced. Alcohol dehydrogenase is the ability to break it down. But what happens is the body's liver starts to react to this because it can't process it. And so it starts to become, it starts to show an actual toxic effect. It starts to get hepatitis, and then something called cirrhosis, where it's the inflammation of the liver. And there's the stages that people go through from fatty liver to cirrhosis. And so a doctor can actually see a liver starting to shut down. So a doctor will say, stop drinking, if you need to, because the liver levels are too high. Sometimes people will not stop drinking and their liver will start to shut down. And I have to say, getting liver transplants are very difficult. And if someone's an alcoholic and they're losing their liver, it's very difficult to get the transplant. So it affects the whole entire body, from the blood to the sexual organs, to the endocrine system, to the cardiovascular system. It actually starts to wear the heart, where the muscle starts to wear down. It affects the kidneys, the fetus. It is very damaging during pregnancy. It's considered a teratogen. There are gender differences in how people process it, and there's also malnutrition. So I want you to look at the gender differences because males and females do process alcohol differently, and alcohol inhibits the uptake of of, um, of vitamins, and so people start to become malnourished. Okay, so now I'm going to move to the second one. Let's talk about behaviors. And I'm not going to spend as much time on this, but I want you to be aware of the different types of alcoholics. And I also want you to know about the behaviors. Now, I'm not going to go through this well, I'm going to kind of do a faster pace on this, but you get the idea. I want you to look at how alcohol is consumed, and that they're binge drinkers. I also want you to see how it's across the ethnicities, and also within high school kids. It's very serious. You can see the rates here. But who is the biggest consumer of alcohol? It's the 21 to 25-year-olds and the 26 to 29-year-olds. It's junior high and high school. We have to really worry about it, because when they start to do it, then their brain's still forming and they become addicted to this. I'm not going to go into the prohibition period and to the drinking, but know that it's been around for a long time. And we've had periods where we've tried to remove it completely, and that did not work. And then it was repealed in 1933. So we've had a lot of, what's interesting though, I find interesting about all this, is that we started to see that it was very corrupted, and that a lot of people still came in drinking and having a hard time giving up alcohol. But I also have to tell you that when you read about the Prohibition period, you're going to see that liver rates and cirrhosis levels dropped during the Prohibition period. So let's define alcoholism. I want you to take a look at that. I want you to know the difference between binge drinking, how fast someone drinks. I also want you to take a look at the CDC guidelines on what's considered a moderate drinker. You'll be shocked. If a woman has more than one drink per day, she's considered a moderate to heavy drinker. Look at that. Also look at what is considered an alcoholic. I'm going to find this here. It's on page 245. What is considered an alcoholic and the different types of alcoholism. So I want you to really understand that alcohol dependency is really where someone's really tied to it. They have to have it in order to function. The other is it's chronic behavior disorder by repeating drinking of alcoholic beverages. And what you need to know, there's different types of alcoholics. There's an alpha alcoholic, beta, gamma, delta, epsilon, and zeta alcoholics. So there's different ways that alcoholism presents itself. And this is another definition. So people have to feel like they crave it, they need it, they have a physical dependence. Now, here's what's really important. It's very hard for people to get off of it when they're physically dependent. They could be psychologically dependent and physically dependent. And then they build up a tolerance where they could drink a lot, and it takes more for them to feel the effects of the alcohol, but they're still drunk. So these are the different types of alcoholics that I mentioned. I want you to know these different types of alcoholics. This will be on your midterm. How about that? Pay attention. There's also a discussion question. I also want you to know that the types of alcoholics in colleges. There's young adults, young antisocial, functioning, intermediate, familial, and chronic and severe. So alcoholism is very, very prominent in the college setting, and it can manifest itself in different ways. And then I want you to understand that there's different types of what they call drunken compartment, where people exhibit certain behavior and it's considered okay to act that way, where it's used as a disinhibitor, where it's used to help move through things. And then a pseudo intoxication, where people sometimes acting inebriated even before the quantity of people start to act drunk before they even are drunk, to help them navigate through situations. Wrap your head around that. That's an interesting concept. And then we have different cultural uses of it, where people are using it to kind of get through different environments. I want you to look at culture. Cultural influences on page 247. I want you to see what the drinking rates among the Jewish, the Irish, around within each culture. We have something called a wet and dry culture. I want you to know that the wet-dry distinction seems to be disappearing, and we're starting to see these things cross. But wet is where it's part of the culture to drink, and dry where it's not part of the culture to drink. And then you'll see things like, having a football party and having behaviors at a football game, or, things like that. And this is the difference between wet cultures and dry cultures. Wet cultures use it as part of their day, of their life, and dry cultures do not. And then I want to put out there that college students consume a lot of alcohol, and how much they consume. A lot. And you can see more statistics here. More statistics to drinking and binge drinking. A lot of it binge drinking, binge drinking, binge drinking. More stats on binge drinking. More stats on binge drinking in college. Women, this is interesting, more women in alcohol treatment come from sexually abused homes in comparison to men, 12%. So sometimes people also treat alcohol to use as a way to treat some other issues. That's called comorbidity, when people are using alcohol to treat, and they're suffering with both alcoholism and something else. And then also you need to know that women are impacted by alcohol. They feel it sooner, they're able to process it less, they possess less of that metabolizing enzyme. Remember what that metabolizing enzyme is called? And I want you to wrap your head around that enzyme also. Okay, and so these are the patterns. And then I'm moving right through the slides, but I want to, oh, good. This is what I want to get to right here. I want to make sure that before we end on this, I want you to know the difference between codependency and enablers. Codependency is a behavior displayed by either addicted or non-addicted family where they're jumping in to help them with their behavior. And so they're doing this to keep this whole kind of cover up going, and they're almost dependent on playing that role with that person. So it's their role to do this. And a codependent, in some ways, when the alcohol changes their behavior, they feel a little lost because they are not jumping in to save the day, and that's called codependency. Enablers are people who are slightly different than codependents. Enablers are those who are close to the addict, who are deny and make excuses for enabling his or her excessive drinking. So they'll say things like, oh, that their blood sugar is too low, or, they just are stressed. They've had a long week. And so, they're sleeping in. That's an enabler. You can read up on that. And I want to say here as a side note that if anyone's ever experienced being an enabler or codependent, it is one of those things that until an alcoholic changes their behavior or until someone comes to terms with this, a lot of times people do not know they're codependent or they're enablers. So hindsight 2020, yeah. But when people are in the middle of this, it's very difficult for them to see it. So if you're a friend and you're trying to show that to somebody and they get angry at you, realize that they're not ready to see it. Also, if you've ever experienced this personally, do not beat up on yourself, because it is very difficult to see it when you're in it. These are the different types of alcoholics and support groups. There are people who are children of alcoholics, and then there are adult children of alcoholics. And there are these groups called, oh gosh, it's blanking on me right now, but Al-Anon, where people actually support people who are family members of alcoholics. Okay, so a lot of people have been exposed to alcoholism. Helping recovery, there's something called psychodrama where people start to act out the roles, role playing, genogram, where people start to look at how the behaviors are. Because once people start to stop drinking, all the roles start to shift in a family. Or sometimes people have to deal with it even when someone decides not to stop drinking. Living with that is also something that people have to sometimes deal with. And then there's also post-traumatic stress disorder, that people are exposed to really stressful things when people are on alcohol. And alcohol often makes people very violent. There's a statistic that shows that almost all domestic violence have some type of alcohol in them. So alcoholism is very prominent in violent situations. So these are the recovery from alcoholism. Denial is a big defense. There's relapse, there's rehab, and there are medical ramifications. And then, of course, people are really fragile, very emotionally fragile. It's more emotionally fragile than other addicts. So I want to tell you that alcoholism actually is one of the hardest things for people to get off of. And because it's both psychologically and physically creates dependence. So these are the withdrawal, the key terms: relapsing syndrome, where they go back; acute alcohol withdrawal syndrome, where someone's addicted and they cannot keep their blood alcohol level up and they start to withdraw; delirium tremens. This is the most severe, even life-threatening. They can hallucinate, they can have delirium, and they can have a fever, and they need to be under doctor guidance. They need to be monitored by a doctor. And I think it's important to know that, like for example, with heroin, people have painful reactions, but they're not at risk of so much dying. With DTs, they're at the risk of actually dying. So it's really important for people to understand that withdrawals can be very serious with alcohol. Now, I want to pull out to one more thing here. I want to pull out to this module, and I want to make sure that you also look at two very important things. I want you to look at the CDC program overview, which shows binge drinking right here. And then also I want to make sure that you take a look at Alcohol Your Health, which really defines the difference between severe and moderate drinking. So this is what's considered binge drinking. For women, 4 or more drinks consumed in one occasion. For 5 or more drinks consumed on one occasion. Heavy drinking looks like this. For women, it's 8 or more drinks per week. So if a woman has 1 drink per day, more than 1 drink per day, she would be considered a heavy drinker. For men, it's a slightly higher. So someone who's having 2 glasses of wine per night, they are moving into heavy drinking. No alcohol for pregnant women. And then for anyone who's under 21, they should not have alcohol because it does affect their development. So I want you to take a look at those.